about CCS is that I've always had a passion for children, and so CCS gives me the opportunity to help children, especially sick children, by providing medical case management services.
Well, CCS is like a family. That's why we're really, I think CCS has really they came in to really support us, and everyone just is really nice. And it's actually really fun being at work.
Yeah. It's been a very positive experience and enjoyable coming to work every day. We feel like we have the same goal, no matter what your position is. We all want to help children.
Yeah, it's a very welcoming atmosphere working for CCS. I've enjoyed familiarizing myself with the children that we care for, and you know, being involved with the families. I actually got to meet one of my clients and her kids.
So what I enjoy most about my job in CCS is that we cover medical care for children that are the poorest and sickest children in Kern County. And we make a difference in families' lives when they're dealing with the stress of having sick children.
CCS program means a lot to me. I went to Vanderbilt University for my nursing, and after that I moved around some, so I worked in various hospitals, which I loved. I always wanted to be a nurse. And then came to Bakersfield, worked at KMC for 11 years, and worked in home health for 10 years, and then came to CCS, and it's been the most wonderful job I've ever had.
I like to help all the children. Especially my cases they're so complex, and I like to see them getting their services on time, and having the parents worry less about their child's health, knowing that we're taking care of that.
CCS for us has definitely helped us out as far as getting our son the equipment and the ability to not be so hindered on his diagnosis, which is cerebral palsy. They have helped us out extremely, how do I even say that? I'm all flustered now. They've helped us out a lot. So I absolutely do admire everything that they've done for us. They've been helpful as far as they really fought for our son to get the equipment that he needed. A lot of doctors were saying maybe he might, maybe he will benefit from it, and they totally pushed and said, hey, let's make this kid's diagnosis not hinder him. Let's help him out, let's get him the equipment, and let's just totally help him out later on in life, because at 3 years old with him not walking, we absolutely need CCS to get us the equipment for him.
Oh yeah, the
Green Bay Cheeseheads.
yeah, I'm not a Green Bay fan.
Oh yeah, very, very easy to work with. So nice, so courteous. I mean, they're really striving to help you out in any way that they can. Very friendly people.
I agree.
I also had a child who was on CCS for a brief period of time. My knowledge of CCS was the impetus for me making sure that my child was referred. They thought that he had a cranial synostosis where the sutures were prematurely closed in his head, and I knew that with special care centers such as the craniofacial centers that he would be able to see the most qualified physicians in the state. We had a very fortunate outcome in that when those physicians reviewed reports and saw the x-rays, they noted that he did not have that condition, and it was something that was more easily treatable and correctable. My scarf is awesome. It was a Christmas gift from my sister 3 years ago, hand knit while I was back in Pennsylvania with her. A Vanna White move.
You're in trouble now.
Oh, I love the San Diego Chargers. I love them ever since I was a kid, and that team is phenomenal to me. The offense is incredible. They played their division opponents twice and I usually go at least once to watch them play against the division foes. So.
Go Bulls!
Yeah, that's right.
Stop for a second.
I know.
We're all on camera?
We are.
Yes, you're all three on camera.
Okay.
So if you're looking down going like this, you're going to be on camera.
Well, everybody that works with me knows I'm a super big Laker fan, and I always manage to get down to at least a couple of games each year down at Staples Center, and I follow them all, tape them all, record them all, I should say, but I like other sports too. I'm afraid that I like Tim Tebow really well, but I don't like Denver's, but I'm afraid they're going to do it.
You having fun?
Oh, yeah, lots of fun.
Yeah, right now.
Oh, my daughter, she's something else. I call her the diva because, well, whatever she wants, she pretty much gets. She loves to put on my bracelet. She loves to put on my shoes, and she likes to, of course I encourage her to, she likes to look at herself in the mirror, you know, because she's seen mommy getting ready, so she wants to get in the mirror too. We like to go shopping, and she's just a lot of fun, but she's also very strong-willed. If there's something she wants and she doesn't get, well, she'll let you know. She'll give you a hard time. But yeah, she's great. She's a blessing to us. You know what, to be honest with you, with this whole Super Bowl thing, I don't keep up with it because I barely have time to watch TV. I just keep hearing the name Tebow. At first I thought they were talking about, you know, like the TV thing, the Tebow, and then I realized, oh, it's a football player. So, anyway.
Have the three of you bonded because you all started at the same time?
Yes.
Yeah.
We're known as the little ducklings. So we leave together always, and everyone's always like.
Yeah. If they see us and they don't, if they see me and they don't see either Sharon or Mina, at least two of us have to be together all the time. If not, the three of us, they call us the trio. So we joke about being joined at the hip.
I'm Tammy Melchak with KGET TV 17, and I'm excited to be your MC this morning for CCS. Such a great event, and what a great video. That video was recorded 4 years ago. Now, we want you to know that your CCS program staff are real people too, as you just saw, and they are truly dedicated to improving services for you. That's why we are gathered here today. 4 years ago, a small group of therapists wanted to do more for their patients that were moving out of CCS and into adult medical care. The therapists arranged a meeting at the 34th Street Medical Therapy Unit between their transitioning patients and a few service agencies. The idea to hold an annual transition fair was born. As you see today, that small gathering has turned into this, the 2015 CCS Transition Conference. So welcome. We want to go through today's agenda, give you an idea of what's going to be going on today. We are deeply honored that Dr. Bob Diamond has traveled here from Sacramento to deliver your first presentation today. Dr. Diamond is the state's medical director for California's Children's Medical Services. After his presentation, we'll have a short time where he is available to answer your questions. After Dr. Diamond's presentation, we have our first raffle prize drawing. Is anybody ready for that? Yes? Okay, I thought so. And before you leave this room to attend a breakout session, you will get a chance to meet the TRAC. Now, TRAC stands for Transition Readiness Assessment Questionnaire. And this team will be circulating throughout the conference, seeking to survey CCS adolescents 14 years and older. And then we will take a short break around 10:40 so you can walk across the conference center to your breakout session. We will have ushers wearing neon green vests, so you can't miss them. They will be posted along the way to show you where the breakout session rooms are. In the first breakout session, we have a demonstration on how to put together your CCS Care Notebook, which is a binder that you make to keep your child's information in. In the other rooms, Omni Family Health will discuss their services, and the Greater Bakersfield Legal Assistance will talk about your rights and how to appeal decisions made by service agencies. In our second breakout sessions, we have presentations on the Affordable Care Act, your local Medi-Cal resources, and the Independent Living Center of Kern County. After the breakout sessions, we want you to meet some of the providers and the agencies that you may be transitioning to, so please be sure and visit our vendor fair. We are serving a light lunch around 12:10 today, and we'll be collecting your lunch ticket at the main doors when you return from the vendor fair. After lunch, we will hear from a parent of a CCS child and how the program is helping her. And then around 1 o'clock, we are going to have our second raffle prize drawing. Can I get a woo? All right. It's coming from the Tulare County CCS program. So you want to kind of mix things up a little and, get those drawings in there. After the raffle, we have a presentation by Kern Health Systems, your local Medi-Cal managed care organization. And following the presentation is the track team raffle. If you're 14 years and older, remember to find a track team member and complete the survey. You will get a raffle ticket for the iPad mini raffle drawing. Has anybody been eyeing an iPad mini lately? Yeah? That'd be nice to have. Yep. All right. And we are going to close the conference with the CCS Youth to Leadership Scholarship Awards. This year, CCS is awarding 3 scholarships. And at this time, hold on. I've just been handed some breaking news. We have a change on the agenda. In your program, we're going to switch the Greater Bakersfield Legal Assistance presentation with Bakersfield College. Bakersfield College will be presenting in the first breakout session, and the Greater Bakersfield Legal Assistance will be presenting at 2 o'clock before the scholarship awards. If you didn't get all that, just come see one of us and we'll explain it, but we'll keep you posted along the way where to go. All right, at this point, I'd like to introduce our keynote speaker. Dr. Bob Diamond joined CCS as Chief Medical Officer in 2010, coming from his previous position as Professor and Chair of the Department of Pediatrics at UCSF Fresno and Chief of Pediatrics at Valley Children's Hospital. He is fellowship trained in pediatric critical care medicine and pediatric gastroenterology. Dr. Diamond was in the inaugural class of the Healthcare Leadership Fellowship of USC's School of Business and Sierra Foundation. He has previously served on the Medi-Cal Liver Transplant Committee, chair of the CCS Pediatric Intensive Care Unit Technical Advisory Committee, and is currently a member of the Emergency Medical Services for Children Technical Advisory Committee. He was also a past president of the Children's Specialty Care Coalition and served on the board of directors. Please join me in giving Dr. Bob Diamond a very warm Bakersfield welcome.
Good morning. I'm going to make a quick announcement. We have translation equipment for Spanish speakers in the back corner, if anybody wants to go check some out. Buenos días, quería hacer un anuncio que tenemos equipaje o equipment, disculpa, para traducción en español. Si lo necesitan, está acá y nomás le preguntan a los trabajadores de CCS si lo necesitan. Disculpa.
Great, thank you so much. Really a pleasure to be here, especially that introduction that probably would only make my mother proud, but I really appreciate the warm welcome. This is my second time here. I really love coming down here. One thing I can say, I really love how the families get involved and the passion the families have shown, and then also particularly the leadership that CCS Kern County has shown at the state level over really now several years. I'm going to walk you through what CCS is, where we're going, what our challenges are. I'm going to say up front, we don't have all the answers to the future, but we're working hard on a lot of them. And I'll be happy to share some of, I think, the great services our program does and where we're going to go with this. Being family-centered is our big focus. Now, if I can drive this. Okay. we've got 2 screens. Where are most of the people? I'll bounce back and forth with the pointer. Unfortunately, it'll make everybody dizzy. Sometimes it'll be over here and then sometimes over here. So who are we? This is funny. Most people don't realize this. Managed care is not new. CCS is the oldest managed care program in the United States. We started in 1927. We currently cover, it's up to about 180,000 children in the state of California. One of our problems is that we cover conditions rather than the whole child. That's, I think, everyone has identified as one of our upcoming challenges for the future and an important part of redesign. Fragmenting the kids doesn't work well. We used to be a $1.8 billion program. I think we're now up to about $2.6 billion program. We're the largest children's really health program in the entire country, and we think possibly in the world also. We do 2 things. Everyone thinks of us as an insurance company, but we're also overseeing the care of kids, making sure they get in the right places for the right services. So we have different levels of hospitals, neonatal ICUs, pediatric intensive care units, special care centers, and I'll show you a map in a few minutes just how extensive our network is. And then finally, one of my last slides goes over some of our quality efforts of taking the entire network and using it to ensure quality. Are we too loud? Nope, is this okay? All right. We panel the qualified providers, so physicians have to go through certain things to get into our program, just like the hospitals do. I believe strongly in this, making sure that we are sending people to high quality providers, and we do a lot of things to work with people to both improve that quality and to even maintain it at times. And then finally, we have both independent and dependent counties, depending upon how large they are. And again, I really thank CCS here locally for being a leader of really demonstrating a lot of innovative ideas. So what are we doing? This is old slides, 2014-15. I've got to come up with a newer one. My main goal is still quality and access. This state is a very heterogeneous state. We have big urban areas, we have big rural areas. I'm very concerned about access in the rural areas. One of the activities I've spearheaded over the last 4 years that we have now just finished is that the interpretation of medical eligibility is the same in every single county. So that if a family moves from one county to another county, what the interpretation of our rules are doesn't change. Getting 40 counties of physicians to agree on something makes herding cats look like an easy exercise, but we were able to do that. And so I'm very happy now that if you move, nothing's going to change. The biggest thing for me is we're really focusing on being family-centered, making sure this is about the patient. It tends to get me into a little trouble periodically, something I'm not unfamiliar with. I want this to be about the patients and about the families. I don't want it to be about the industry. A lot of folks in Sacramento focus more on the industry. I focus on the patients and the family, probably because I was a bedside physician for 25 years, and it's the families that I took care of, not the industry. So I'm going to stick to that as long as I can. This is all about quality and access. We're going through CCS redesign now. There's a lot of fear and trepidation about what's happening with our redesign process. Families get worried that things are going to change for them. Let me say that the basis for this is what's called the CCS managed care carve-out. That legislation that enables CCS to be carved out of most managed care ends at the first of the year. But what most people forget is this is the 5th time that it's ended. The previous 4 times it also ended and always got extended. A lot of activity in Sacramento, what alternative there is. I've not heard one that particularly sounds viable. I'm not real worried about this sunsetting. As our egos go, the last time was 5 years ago. I was the president of the Children's Specialty Care Coalition at the time. I testified 9 times to the state legislature. On my last 3 times, when I saw people sleeping through my presentation, I got the feeling that what I had to say didn't make a whole lot of difference. It didn't. But what did matter were the families. The night before the vote, 2 parents took their kids in the West Capitol steps in wheelchairs, took the kids out of their wheelchairs and just put them on the concrete. I wasn't real happy to see that, but they did that. The TV cameras were rolling. The next morning, the CCS extension passed almost unanimously. The power of the families should not be underestimated. Your guys' voices are huge. We recently had a Family Voices Lobby Day up in Sacramento, and I participated in some of it. I can't go to the actual senators, but I know in talking to people and doing all that, they don't care what we have to say. They really don't care about the leadership. They greatly care about what the families say. So your guys' advocacy really matters. If you have an opinion that you want something done with the sunset carve-out, make sure you talk to your state legislators. They won't listen to me, which is fine, but they will listen to you guys. And so I never underestimate the importance your voice carries. Go on to next. What has changed? The federal government, who funds half of what we do, has always looked at us with a funny eye, and it's our fault. We've always given the wrong message. CCS forever has presented itself as an insurance company, and we're not. We are in part an insurance company, but in part we're what I call a public health agency. We oversee the care, we oversee the providers, the facilities, and things like that. But in continuing to maintain all of that, what we do need to do is transition from the condition to the whole child, from the carved out models we talked about to carved in. I'll show you in a few minutes why that really doesn't matter. But again, describing us as not just an insurance provider, but really organizing and overseeing the care here. We've been doing it, we just haven't claimed credit for it. And now that we've changed our message, I think people are understanding much better what it is that we do. And then, like I said, we need to get away from the fragmented care. And for me, being family-centered is easy. That's where it's always been and always should be. So what are our redesign goals as we look at what to do? Patient and family-centered approach, you're going to hear me say that a lot, but I also feel like I can never say that too much. The families are the ultimate care coordinators. We help, we assist, but any mom or dad that has a child that sees 5 different subspecialists and lots of problems, they know who their main care coordinator is, and it's not anybody on this podium, it's the families. We want an organized delivery system. We want this to be less fragmented. People shouldn't have to go crazy figuring out what form to fill out, who do they work with, how does it go. We are going to maintain our quality improvement programs. That's something I am very firm about, and I'll show you 2 examples of what we've done at the end of this talk that really underscore some of that. I would love to streamline care delivery. I've heard enough from parents that they've had to make 4 trips to the same healthcare facility last month because each subspecialty visit was on a different day, things like that. That doesn't work for the families. It actually doesn't work for the system either, because it's better to have one set of appointments and do all that. We're actually looking at some innovative models of how to make that better. And this seems so obvious. We have to learn from our mistakes. When people talk to us about what doesn't work, we need to pay attention and listen to that. And I'm actually happy to say the folks in Sacramento are starting to do that. And cost effective. Interestingly, we're not under a tremendous amount of pressure to lower our costs. So I'm very happy about that. Our budget has gone up a bunch. I keep getting the terms to me of cost neutral. I can live with that. That means I don't have to reduce things. I just have to sort of keep them where they are. Sorry about this slide. It's a little busy and confusing, but for anybody with concerns about managed care, this is the most important slide of the talk. I'll walk you through it. So this is from the 2011 state law, Health and Welfare Institution Code section. Any managed care contractor serving children, so if your kids go off into Medi-Cal managed care flavor A, B, C, E, strawberry, vanilla, whatever it is, that managed care program must maintain and follow the CCS standards, has to use the paneled providers and CCS clinics and hospitals and everything, so they can't take you out of your CCS environment. They have to follow the CCS treatment plans, have to use the specified services, And the last sentence is among the most important. This is not to allow any reduction in benefits or eligibility under the CCS program. So we already have in state law that managed care has to follow the CCS facilities, programs, and plans. My somewhat simpleton version of this is I don't care who signs the check at the end of the day, as long as the right patient is seeing the right set of providers and getting the right care. If you need, for example, here, if you needed complex heart surgery, you go up to Valley Children's. Who signs the check to them doesn't concern me. That you go to a CCS-approved hospital with CCS-approved doctors and getting your CCS services, that is what counts. And so we already have this in place, this law in place. I spend a lot of time educating people about this because I think they don't really realize that managed care, I'll use the term, has to play fair. And so really managed care should not be the enemy, they should be the facilitator. So that's part of why the whole redesign process, to me, I'm not that concerned about. I'm happy to say very clearly, no reduction in benefit or eligibility levels under CCS, and they have to use the CCS programs. So that, I hope, is reassuring to folks. Whoops. So let's go back through a little history of our program. Just this makes me feel not quite as old. CCS started in 1927, was established as a program for crippling deformities. Thus, we were called Crippled Children's Services for a long time. Not a very popular name, but that was the name that our program had. Really started with the polio epidemic. In 1935, the Social Security Act, Title V, Part 2, expanded its services for locating crippled children for both medical and surgical and corrective services, suffering conditions that could lead to crippling. In 1978, we became a little more politically palatable and changed it to California Children's Services instead of Crippled Children's Services. People didn't like enrolling in a program that labeled you as crippled, and it really made no sense. So I think we've gotten better at that. I like to stay out of politics, but if you have any question about the need for vaccines, please look at this photograph. This is before the polio vaccine came out, and this is what happens when you're not immunized for polio. You end up with lots of children and adults on iron lungs, and this is Rancho Los Amigos down in Los Angeles, where they had a room full of children and adults who got polio before the vaccine and lived in this. I cannot imagine anyone wanting to make their child live their life like this. And so I think the vaccine issue is largely an educational issue. I grew up with taking the sugar cubes. I was the first round and first era of vaccines. Unfortunately, in my times as a critical care physician, I've seen a lot of bad kids who didn't get vaccinated. Whooping cough in infants has a pretty high fatality rate. And so I think people need to understand the issues related to this. Okay. Next came, there we go. 1940s, rheumatic fever was added, cerebral palsy, as we started to be able to treat and identify some of these conditions. I like the pictures better. This is, in 1955, the first baby getting what's called congenital heart disease surgery, being hooked up to heart-lung bypass, something we now think is commonplace and very easy. It's one of the things that started after I was born, not before. So it's really amazing to me that we've been doing these type of heart surgery operations on patients. It's great, and it's actually what this transition conference is about in part. We now have so many children that have had successful congenital heart surgery that they now go on to the adult cardiologists who have no idea what we have done. They're used to seeing standard hearts with 4 chambers that adults get what's called coronary artery disease. When an adult cardiologist sees a child that only has half or 3/4 of a heart, and we've moved blood vessels around and have them on all sorts of complicated medicines, they look at us like we're crazy and want to send them back to us. So the big thing is, as we work on transition planning, what to do with kids when they turn 21, That's a very important thing, both in training the cardiologists, how we work with things, but also empowering you guys to be advocates for yourselves of how to participate in transition planning. I can't thank Tony and the rest of the team here enough for tackling this. This is, I think, the best proactive attempt at transition that I have ever seen, and I really applaud everybody and like their efforts, and I'm bringing this back to Sacramento. Okay, PKU, whoops, all right. Here you can see, it may be a little tough to see in the photograph, poor little baby getting the needle stuck in the heel to go on that little blotter paper. We started doing metabolic diseases a long time ago because we learned that with PKU, it's called phenylketonuria, if you identify it in the newborn period, put them on a special diet, you will prevent them from getting mental retardation. And so we have a whole, now it's way more than one, but a whole list of things we test for as a newborn to identify these treatable metabolic conditions so that kids can live on, have happy, normal lives. And this is cystic fibrosis, added in 1961 because that was all treatable, and now we've got a lot of kids. Used to be the life expectancy with cystic fibrosis was 13 years. It's way past that now. And again, transition becomes so important. This would hopefully be about neonatology next. Yep, hyaline membrane disease. John J.F. Kennedy lost a child from being premature. After that, prematurity was added to our things, and so now we have lots of neonatal intensive care units, and that has just taken off. Gone from a baby this big, being of questionable survival, we now have children down to this size. 700 grams, a pound and 3/4 is now considered a large premature baby. So medical eligibility, it's now in regulations, it's there. In 2000, physically handicapping is the focus, wide range of conditions. We keep adding more and adding more. Now I want to get into how you get off of CCS. This is the challenge that we all have here, which is to me what this conference is about and what's so important. What do we do when the kids turn 21? We have CCS, it's, someone asked me to describe CCS in 2 words, and I was able to do that. It's called value added. We add so much more to the standard care of infants and children with chronic conditions. But what happens when they turn 21? The value added part goes away. It's by state law. I can't change that age. The lawmakers have to do it. But the bigger part is we need to get the kids and the families empowered of how to work with this transition, what to do. We are putting a lot of pressure on our adult providers to step it up. We've got a large population now of kids turning 21 going into the adult world, and it's not ready for them yet, and we need to help them get ready. So again, it will sound like a broken record. Can't thank you guys enough for really taking some leadership steps into looking at this. CCS is also a financial eligibility program. You have to be at some percentage of poverty to do it, but the other part that people don't realize, you can qualify for CCS no matter how much money you make if you spend 20% of your income on your medical care. So there are 2 ways to get in. One is the standard Medi-Cal way. The other way is by spending that much. And as much as healthcare costs now, that is not unusual to hit the 20% marker. Our medical therapy program has no financial qualifications. Anybody can get into that. So you can get closed for turning 21, losing financial eligibility. If you don't live in California anymore, obviously you lose that. And then loss of medical eligibility if the condition is resolved. No point in being in CCS if you don't need it. We're struggling with this one of how to do it because if a baby gets a certain type of heart operation, for several of those, you're operated on, it's fixed, you have a normal heart, your chambers are all normal, you don't need to stay in CCS forever. We don't know at what age is best to get you out, but we don't need to be seeing kids 18 years after their surgery when they have no medical needs other than normal stuff. So we're sort of working on how to approach that one. I wish this was a joke. We now have what's called the Affordable Care Act. Someone took all of the pages and printed them out of the Affordable Care Act, and they piled them up. No, I have not read the whole Affordable Care Act. I actually don't think anybody has. It's very complicated. Its goals are much of what we talked about. It's quality and affordable health care for everybody, using quality programs, improving quality and efficiency of care, looking at all these different things. Someone asked me how the Affordable Care Act impacted CCS, and my answer was, it didn't. We're already way ahead of that. We already covered everybody with CCS. It's interesting. I made a prediction that the number of children with cancer, with heart disease, with some other major things before and after the Affordable Care Act would not change. And in fact, that's exactly what happened. Everybody with cancer was already getting cared for in California. Or I'll say all the children with cancer were already getting cared for in California. We had no more referrals come in. What it has done is gotten more healthy kids into the system, kids with minor, like a little bit of mild asthma or a cough or that kind of thing. But the serious stuff we already had. And so I'm very proud to say that we didn't pick up any more patients, which meant we weren't missing any. Covered California, just to put up here, is one of our vehicles for doing that. Again, I think it's been a great boon for getting people into a primary care system that weren't in it before, but we've not seen any more referrals. The main value of Covered California is like everything else, consumer-focused, partnering together with different programs and making that work. So how do we fit into the big federal pyramid? Like I said, we define eligibility, neonatal care, making sure the right centers are done, and working with county CCS. This is a lot of teamwork, but I think it's been great as far as getting the kids the care they need and that type of stuff. So like I said, we have been working hard and switching from being an insurance company to making sure that the regionalization of care is here. I take much more serious than being an insurance company, making sure that your CCS approved hospitals down here are providing the proper care, state of the art, that not to say, well, we're in a rural county, we don't have to follow the CCS rules. No, that's not true. We want all the local hospitals to be just at the same level as the bigger hospitals for CCS care. A premature baby here should get no different care than a premature baby does in LA or San Diego or Sacramento. And I think we're very far along the ways of doing exactly that. So we have different hospital designations. I won't bore you with all that. Different levels of intensive care units, NICUs, community centers. These are our regional hospitals, and we have community hospitals and general hospitals. This gives you an example of our challenges in California. We, when I did the slide, had 338 facilities approved by CCS. No shortage of density in the LA area. Even the Bay Area is still kind of more smeared around. But you've got no tertiary in a couple of our community hospitals up in the North State here. This is the size of Arizona, and we have almost nothing up there. If you look at the Inland Empire here, the Central Valley is also fairly underserved. So we're really working hard to take this massive geographic diversity, but always make sure our minimum standards apply to everybody. And we'll be coming to visit the hospitals here soon. I know Kern Medical Center is going to get a visit by us shortly, and I think we'll be working hard on continuing what we've done, which is to be collaborative to help people improve the care. We're not here to be punitive or penalizing, but to make sure everybody's getting the state-of-the-art care that they need to get. Same here, we have 120, it's now I think 126 NICUs, neonatal intensive care units. Same thing, all across the state. Not hugely dense there, much more dense in LA, a little bit in San Diego. Even Orange County is a little spread out. I'm sorry, that's Orange, there's San Diego. Again, the valley there's some, but not as dense as we would like to see. And up here is just very little. So we're, again, trying to just bring this all together and make sure that the kids get the care they need everywhere. So we've added more than 20 CCS centers in the last 18 months. Our goal is to expand access, have more places out there for families to bring their kids to so they can get the care they need. But we're not letting people dilute the high clinical standards. I want to be able to say, if you go to a CCS hospital, you're going to get high-level care no matter where it is, and that's been really important for us. So we're going to keep working on
Desired outcomes are more of what you've heard before. They want cost effectiveness. Care coordination is hugely important. Transition planning. Again, I just can't thank you guys enough for being proactive on this. We need to look at ways to do that. So the transition planning here that's getting started at Kern County, the TRACK program, system and questionnaire, really is wonderful. I plagiarized this from Tony's stuff. You'll see this later today. But creating a venue for people to get into transition, assess the readiness, perform interventions, and collaborate with other entities to develop individualized transition plans. This is so hugely important. I know parents are still parents when their kid turns 22, and they want to make sure their children are going on to get great health care and going where they need to go. Just two things I'm going to give you as examples of our quality programs, and then I'll stop and be happy to answer any questions. Dr. Schulman and myself, but really Joe Schulman, our neonatologist up at CCS in Sacramento, along with Jeff Gould at Stanford and others, just published this last month in the journal called Pediatrics. This is going to transform neonatal quality all across the country. First effort from CCS in a long time like this. We're obviously very proud of this, but it looked at neonatal intensive care antibiotic use. We felt that there are too many antibiotics used in neonatal intensive care for the wrong reasons. And because of that powerful neonatal network I showed you, they were able to look at 52,000 infants in 127 neonatal units across the country. No other study, no place else in the world can take this large of a network and study the patients. And we didn't just sample some of them. This is every single baby in a neonatal intensive care unit in the state of California. What we showed was that antibiotic use varied 40-fold among the different hospitals. One hospital had 97% of their patients on antibiotics. Other hospitals only had 2.4% of their patients on antibiotics. Most important part about this is that many of the hospitals reported infection rates of 0 despite all of these antibiotics. But right here, at all levels of care, antibiotic use was independent of proven infection. So we've now shown that there's way too many antibiotics used in California. It's independent of infection. This needs to change, and now we're starting a national collaborative that Joe is leading to look at how to tackle this. We're not trying to criticize anybody here. We're trying to say we have a great opportunity to improve the care that our children receive. And this is hit the national news real big last month. Huge pressure for national collaborative. Like I said, it's in the journal called Pediatrics. It's the official journal of the American Academy of Peds, and they've really embraced it. There was an editorial accompanying this saying, this is huge. We all need to jump on the bandwagon to make this better. I think when you think about it, if you take a little baby this big and put them on a lot of antibiotics for no good reason, you've sterilized their whole GI tract. That is not a good thing. If they need it to treat an infection, no one argues with that. But if you don't, then there's a problem. Last thing I'm going to cover is we started what's called a pediatric palliative care program. I mentioned this a little bit last year. This is a program where it's really vertically integrated top to bottom care of people entering palliative care. This is not a dying program for the dying. It's not an end-of-life program. As it turns out, of the 72 patients that entered this program, at the end of our 18-month study, 70 were still alive. What you need to get into this is just a predicted 1-month hospitalization. But this is the first program we really got into where we looked at intense care coordination and really a 24/7 phone line, all of these intense services that are family-centered. This is our satisfaction survey of 9.8, 9.8s, 9.6s. Even this drop down is still 9.1 and 9.2. These are satisfaction scores our program has not seen before. Our families are happy, but not this happy. So the palliative care was a raving success as far as engaging the families, getting them going, and really being customer-oriented in our care. And lastly, it also accomplished what the bureaucrats wanted. This was the cost before the patients enrolled in our palliative care program, and these were their costs afterwards. This is the best example of what I call bending the cost curve, which is a large economic term that people use when talking about healthcare. So this, we accomplished both goals. We had patients do very well, families very happy, and we were able to make it more cost effective. So I'm very pleased that, again, this is another quality program that we're looking at of how to do things better. So on this, I'm going to say thank you and really happy to answer questions. And I'm privileged to have a program that serves so many families and so many people. But again, I just plead with you, speak your voices to your state government. Let people know what your thoughts are and make sure you're advocating for yourself, because nobody can tell the stories like the families can. Thank you. Happy to answer questions. When you're the early morning speaker, there's usually no questions. That's why this is better in the morning than the afternoon. Questions from anybody? Yes. I think they have a microphone for you.
Oh, hi. Thank you, Dr. Diamond, for coming and educating us as advocates and being an advocate, especially in the California state system. I appreciate that very much. I'm a parent of a severely disabled child who's benefited from the palliative care program.
Oh, great.
Probably one of the statistics you've displayed. My question is, you know, my daughter's 19. Obviously, I'm here at a transition conference for that reason. Are you aware of implementing a task force focused on helping the healthcare system in general? And are you aware of any government organizations that are actually working toward, for example, a palliative care program for adults, young adults that, in my case, my daughter will be dependent her whole life as an adult as well. So her condition doesn't change just because she turns 21. What are your thoughts on that?
It's one of the few areas I actually do have some progress being made on transition. There was a bill passed in the Senate last year authorizing adult palliative care. And so we are actually helping the adult folks come up with how to provide this for adults. Like I said, I'm more interested in the first slide that shows the family satisfaction. They were more interested in the second slide that shows that it saves money. The reason I feel optimistic about that is the governor's included those cost savings in his budget. So now we're told we have to deliver, which I think is great. So I do think there's light at the end of that tunnel for your family, probably more for palliative care than there is for some of the other services. It's not up yet. If she's 19, I think it should be in place by the time you get there. So on that one, thank you. I think we do have better news than some of the other ones. Thanks. Well, I'm getting off easy. All right. Sir. He'll bring you a microphone. Please speak up. I have problems with hearing, so it will help.
Hi, I'm Juan Gonzalez from Kern County Mental Health team. So I guess mostly had a question as far as, I know with a lot of these kind of physical issues that kind of happen, I know it adds a lot of stress to families. Kind of, since I'm from mental health, I'm kind of thinking from this perspective, do you guys offer any kind of mental health services to these kind of families that are going through something like this, or are there any plans in the future to include that?
I'm sorry, do we do what?
Any mental health services for the families that are
kind mental health services?
Yeah, that are kind of going through this kind of rough transition, because I know it's a lot of stress on families as far as going through these kind of issues. So
I think that's a great question. The state, I will say, we're not as far advanced in our mental health programs as we need to be. We're more dependent on a lot of the county services. I think it's finally being identified of the great mental health needs of two different types. One is among our current CCS clients, they have mental health issues. I think that's a little bit easier to tackle. What I'm more concerned about are sort of the primary mental health conditions that we are not doing a good job with. And so there's a lot of traction in the state of how to start to tackle that, all the way from autism and the autistic spectral disorders to some of more of the outpatient-based mental health issues. I think we definitely have opportunities to improve on that. I'm hoping we see that in the near future, but it's coming slowly, not as fast as I would like. Right behind you. Whoops, gotta grab it.
Sí, buenas tardes. Tengo una hija de 19 años y yo quisiera...
I'll never be able to understand her. Like I said, I don't hear well. I've had 2 ear surgeries.
I have a daughter who's 19 years of age. Y quisiera saber si va a haber beneficios para más adelante y si nos puede proveer a cuál agencia podemos ir.
And I'd like to know if you know of any services that could be offered after she turns 21 and what agency we should talk to.
Porque sí le agradezco mucho, porque sí ha avanzado mucho mi hija, pero mi preocupación es porque ya tiene 19, va a pasar a los 20 y qué va a pasar en el futuro.
So yes, I'm just a little worried now that she's 19 and she's still in need of services, and we've gotten a lot of help from CCS and what we would do next.
Great questions, and that's why I think Tony and the group here is being proactive at looking at this. This is, we don't have answers for that within our state laws, but there are a lot of patients that need services when your condition doesn't go away. So I think that part we understand how best to do it. I'm glad you're here today to help empower everybody to speak up and start doing that. The number of adult providers who want to see the kids when they turn 21 is limited. And so we really need to work on engaging them, engaging their systems, and getting managed care to be part of the solution. So I don't have all the answers today, but I'm hopeful that this type of get-together will help to address some of that. It's a challenge. It's a problem.
Thank you.
And that's why, like I said, I'm so happy for this meeting. All right, if no other questions, again, I thank you very much and appreciate everybody listening and great questions and hopefully decent answers. Thanks so much.
All right, at this time, we are ready to give away our first raffle prize. Dr. Diamond is going to do the honors along with Nina Sidhu, the CCS public health nurse.
Yes,
All right, are they all orange tickets? I'm not sure, but just in case, they're orange ticket. And the winning number is 784-030. 784-030, right here in front. All right. And what do we have for a prize? Okay. Oh, she's got it. Okay.
You know that she got it because she's a Laker fan.
All right, we're going to draw for one more prize. And she's going to donate it to one of our families. Very nice. Thank you. All right, we have another winning ticket drawn. This is 784-016. 784-016. Do we have a winner? Let's try one more time. 784-016. Everybody's looking. Should do one more call. Okay, all right, we'll do one last call for this one. 784-016. Any going once? Going twice? Okay, we'll go ahead and draw again. How about 784-031? All right, in the back. Thank you. All right, that's it for now. We'll have some more drawings in just a little bit. Thank you so much, Nina and Dr. Diamond. At this time, I'd like to welcome the track team up here. They're going to explain a little bit more about what they're doing and also how you can find them.
Hi, everybody. Can you hear me okay? Because I don't do well with this public speaking thing. So, my name is Gina. I am a case manager with CCS. I'm also a mother, a caregiver, and an advocate for my 17-year-old child who has special medical needs and sometimes challenging medical needs. So, right now he's turning 18 next month, so I'm all in this transition as well. It's a scary time. So I understand it. I just wanted to share real quickly how important this survey is. Last year, my son's class actually did a assessment type thing to see how well they were ready for adulthood. So my son was asked what medicine he takes on a daily basis by the school nurse, and he so proudly told them, I take 1 blue pill in the morning, 2 white pills, and a blue pill in the evening. So you can imagine that I got a call right away from the school explaining to me that that's not a good thing, that he doesn't know. He couldn't explain what the names were. He couldn't explain what he was taking them for, and he was 16. So this survey is extremely important for your child to fill out. We need to assess what they know about their own health condition, what they expect their health condition is going to lead to. So it's a 1-page survey. If your child isn't here tonight, they'll be contacted probably later. What else? They have to be 14 to 21 to take the survey. You heard about the iPad mini, so hopefully all of you kids that are here, or teenagers, 14 to 21, you can find us. We all have our blue vests on. There's a table over there. The ones that don't have your teenagers here, come and talk to us. Tell us what your fears are. Tell us what you want your child to know, because it's really important that they take over their medical care and know what they're doing for all their needs and transition. Okay? Anything else? We'll be out and about. I don't know, did I miss anything? Okay, this is the track team, so come find us, okay? And that's it. Thank you.
I mentioned they were going to say how you could find them. Well, I guess the blue vests are kind of a giveaway, so shouldn't be too hard. All right, at this time, it's time for you to attend your first breakout session. We want to ask you to please follow the ushers who are in the green neon vests to our breakout rooms. And we'll be back here in just a little bit to continue on with our program and draw for more prizes.
ride a bike or a scooter. When he turned 1, he proved those doctors wrong and showed them he is capable. Also, I would like to let you know I would have had to sacrifice my high school years if it wasn't for this program. I wouldn't have known what to have done. If it wasn't referred to me. I'd like to let you all know I graduated class of 2013 and valedictorian of my class. I was also Thank you. I was also chosen to speak at the Petroleum Club. Me, the only one out of the 3 graduation speakers. And 25 days after graduation, I got hired on 2 job positions and have been working ever since. I just completed a business Clarisha program in which I interned with this summer at child support, hopefully to be hired on to be a more resourceful and responsible living and caring parent, in which I am today. With the help of California Children's Services, I'd like to thank you all and also to let you know I highly appreciate you all. Thank you.
What a wonderful success story. And look at Frankie proving those doctors wrong. That's what we like to see. Before we continue on with our presentation, who would like to win a raffle prize? We need to have like a bell. Ding, 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 ding. It's time to draw for more prizes. And we're going to welcome up some folks with the Tulare County CCS to draw the winning tickets. Does someone have the tickets? Should I just make up a number? Tickets, please. There they are. It's coming to save the day. Anyone ready for a Coke and a smile? Oh, wow. There's a lot of sugar in this next raffle prize. We got candy, we have Coke, Milk Duds, Reese's Pieces. It's for movie night. Okay, the winner of the movie night prize is number 784024. All right, congratulations. Okay, we have 5 more raffle prizes to give away. Do we have our prize? I'm going to find out what our prize is, and then I'll read the number. I know it starts with 784. Does that help anyone? Oh, look at this nice beverage dispenser. Hey, it matches my shoes. All right, the winner is 784043. All right. Okay. Thank you. Oh, it does? Oh, okay. Oh, it's 2 pieces. Okay, nice. All right. Yeah. Oh, okay. All right, next up, who wants some movie tickets? Movies are expensive these days. Gosh, you go to the theater, it's crazy. So this will help. 784054. There's two. Okay, 2 movie tickets in here. 784054. 784054. You got it? All right. You are going to the movies. All right, let's see. Our next prize is, oh, nice, a 5-game combo set. Hey, just in time for summer. All right, the winner is 784026. 784026. Back here? All right. All right, next up we have an ice chest. It's the best kind because it's on wheels and it has the handle. You don't have to try to lug around something that's super heavy. All right, the winner is 784005. I heard we're, oh, there we go. That's a lucky table back there. Oh, this is the one I just got. Okay. Oh, Starbucks? Okay, Starbucks gift cards. And the winner is 784023. Oh, were you close? Oh, I'm sorry. I hate when that happens. 784023. You were 2 too? Oh. All right. Congratulations. One more? Okay, we have one more before we draw later for the iPad mini. This is a really nice raffle prize too. All right. This is a charcoal grill, complete with utensils. Very nice. It is barbecue weather. The winner is 784038. 784038. Is it heavy? Do we have the 038? Oh, back here? No. All right, we'll do one more time. 784038. Going once, going twice. All right, I guess we will draw again. Everyone's like, yes. Okay. 784-015. Back here? All right. Don't forget, we're going to draw for the iPad mini in just a little bit. Congratulations. You got it? Okay. All right. Our next presentation today is by Deborah Murr, the Administrative Director of Health Services for Kern Health Systems. Deborah Murr is responsible for managerial oversight for all facets of case management, as well as health education and quality improvement for Kern Health Systems. She has proven to be a good friend for CCS and regularly meets with them to solve problems and improve services. Please welcome Deborah Murr.
I'm not Deb Murr, but I have a quick announcement. You have until 1:30 to do the track survey in order to be entered into the raffle for the iPad.
And just right here? Okay. Good afternoon, everyone. I'm here from Kern Health Systems, or Kern Family Healthcare, as most of you may know. We are a managed Medi-Cal health plan in Kern County. And what I would like to talk to you about today is, for many of you that are in this audience, you are going to be transitioning out of coverage of your health care under CCS, or California Children's Services, into one of the managed Medi-Cal plans in Kern County. If you are not currently enrolled with Kern Family Healthcare, you may be enrolled with one of our partners or our collaborators, HealthNet. And if you're not one of their members, you may be covered under Medi-Cal fee-for-service, which is traditional Medi-Cal coverage. So what I wanted to talk to you today is give you some ideas of our goals and objectives as to what our plans are to help you make this transition as smooth as possible and as easy as possible for you. We want to make sure that we develop and implement some strategies or some ideas to improve the quality and continue the access that the adolescents or the young adults have had since they've been involved with Kern California Children's Services, and making that seamless transition to Kern Family Healthcare. I want you to understand what the importance of ongoing care, continuity of care, continuous care that we are able to provide to you as when you become one of our members, or you just we're responsible for the health care for your condition that was previously covered by CCS. I want you to understand some of the benefits that are available to you under Kern Family Health Care. And I'm going to provide you some information as far as contact information and 24-hour access that we have available to our members. So just a little background on Kern Family Health Care. We are a Medi-Cal managed health plan in Kern County. We are 205,000 members strong. That represents 1 in 4 members in Kern County are enrolled into our health plan. That's a dramatic increase from last year in early 2014, where we had a mere 135,000 members. We have 11 acute care hospitals in our organization. We contract with 5 tertiary or higher level of care children's hospitals and university hospitals. We have over 300 primary care providers and 500 specialty care providers. I wanted to talk a little bit about our membership. So I told you that we have 205,000 members, but as you can see, our family members are much higher than the rest of our population. 151,000 members belong to family and children. So today I wanted to kind of touch on some strategies or ideas to make this transition much smoother for not only the children, but the parents as well. We want to make sure that we empower the members, okay, particularly the young adults, because they're entering an age now where they're going to be responsible for some of their health care decisions. They'll be aging out, they'll be 21, and sometimes in the next few months, maybe the next year. And it's important that they understand what resources are available and they understand their disease process, which may have already been provided with the services that they received with Children's Health Care and CCS. But we want to continue that education and make sure that they have those same opportunities to continue to learn and understand their conditions. I'm speaking today because I'm here from Kern Family Health Care. But a lot of the issues and some of the concerns that you may have, regardless of whether you're enrolled with us or HealthNet or receiving Medi-Cal fee-for-service, some of these opportunities and benefits are available across all three of those services. So I want to talk about what I have available with Kern Family Health Care, but we want to make sure that we make consistent and ongoing interventions. We don't want to have gaps. We want to make sure that when you come into our health plan and under our coverage for your condition, that we're able to provide ongoing care, hopefully with some of the same providers and the same services, because there are differences in some of the benefit packages, but we strive to make sure that we don't have any gaps in those care. We provide assistance with appointments, not only with scheduling appointments, but transportation as well, and I'll talk about that a little bit later in the presentation. Access to specialty care is very important. Many of you are already established with specialists, some local, some out of area, and we want to continue to provide those services to you to the best of our ability. We also provide a language line and translation services. We understand that English may not be your primary language, and so we have availability for not only a language line, we have Spanish-speaking representative, Spanish-speaking nurses, and Spanish-speaking 24-hour nurse advice lines as well. So I want to talk a little bit about primary and specialty care. We have a very extensive provider network, both local, out of area, which means it's not located in Kern, tertiary, or as I said earlier, a children's specialty hospital, a university hospital like UCLA or USC, California Children's Hospital in Madeira are some of our tertiary facilities. We have contracted providers that are currently in our program and in our provider network, and we have those that we provide services for outside of our network as well. Many of your current CCS providers that you currently see are contracted with Kern Family. One of the things that we encourage our members to do is to allow them to continue to see some of these providers for over a period of time to allow that continuous care so we don't reduce those gaps in care. We offer letters of agreement, and what that means is that sometimes when a provider is not contracted with us, we have to make special arrangements for you to see that provider. And Kern Family does that on a daily basis, not only for children transitioning from CCS, but our membership at large. And as always, at any time, if the members want to change their providers to an in-network provider that's close to their home rather than traveling outside of the county, and it's the same type of service and the same specialist, we'll be happy to make that coordination for you. When I talk about continuity of care, what that really means is that you're allowed to see the same provider that you're currently seeing for a certain amount of time or even a prolonged amount of time, even if they're not contracted with us. We want to make sure that if you're ongoing having services currently for a specific disease, that we make sure that you're able to continue that treatment, particularly if it's something that needs to be continued over a period of time. So if you have a surgery that's already scheduled and you may be aging out before that surgery is able to be performed, or there's a treatment plan that's been spelled out by your provider that we want to make sure that you have certain access to medications or certain access to physical therapy or even other types of specialists, we want to make sure that we reduce that gaps in receiving that care. We want to provide that continuity for a minimum of up to 12 months. So from the time you transition out of children's services into Kern Family Health Care, we want to make sure that those services are available to you. And there's 3 simple steps that we do to make sure that we understand the relationship that you have with your provider. We want to make sure that we can establish that you've already been seen there. We want to make sure that the provider is willing to come either into our network, or we can make a contractual agreement with them so that you can continue to see that provider. And as always, we want to make sure we're ensuring high quality of care, so we have to make sure that the provider that's providing care to you does not have any issues with quality or any concerns with the medical boards or things like that. So we make sure that the provider is in good standing. Sometimes continuity of care may not be able to be arranged, and we take that very seriously. We want to make sure that we make every effort to allow that continuity of care to continue, because we understand that oftentimes you may have been with this provider for 5, 10, 15 years. And so if we're able to continue that continuity, that's important, just as important to us as it is to you and your family. One of the concerns that we hear oftentimes regarding the ability to get to a doctor's appointment involves transportation. We know that there's a lot of barriers to that. Sometimes you don't have access to a personal vehicle. Public transportation is sometimes not the most reliable. There could be physical or behavioral limitations or issues where you are unable to ride a bus. You could be located, out into the hills or into the mountains where there's not a lot of bus routes, or there's just not a lot of access to a lot of different things. The bus routes can be limited, and then just the frequency of those buses and the timeliness that we're able to get you to your appointments on time. So the options that we offer, we do have Greyhound bus passes. We have non-emergency medical transportation, which means we can arrange for a van or a small vehicle to come to your home, pick you up, take you to your appointment, which may be local, or it could be in UCLA, it could be in Madeira. They wait for you, and they bring you back home. We encourage members, if they're qualified, they can get a Lift application. The only limitation to that is that sometimes it takes up to 30 days for an approval. But that does give you very reduced ridership and cost, and they also come right to your home and pick you up and take you to your appointment and bring you back. And one of the important things that we also provide, which you probably already experienced with California Children's Services, is case management. We do offer nurses who are able to help you with your appointments, any questions that you may have, concerns, if you're having issues, difficulties of getting certain office visits or services provided for. We do allow for our case managers to assist you with that and help you make sure that you're able to get through all the services that you need. For those of you who may not be familiar with Kern Family Health Care, there are policies and procedures that we follow in order to request authorizations. What that means is that your provider, your social worker, your mental health provider, your doctor, will simply fill out a form, attach some of your information to it, and we'll look at it and they'll request a certain procedure or service, whether it's a specialty office visit, if it's for a particular, maybe physical therapy, maybe you need a walker or a wheelchair. And we have our nurses and medical directors look at that, and we make authorizations based on the medical necessity and the certain condition that you have. Just as a brief overview, authorization classifications, you'll get letters and notifications from our staff telling you whether something's been approved or it's been denied, or we've delayed something for additional information. We have the ability to turn things around in one day. If there's an urgent requirement, we can do it in 3 days. And most routine or the standard request can be turned around within 5 days. And we just don't make decisions based on our feelings or just general knowledge, we look at evidence-based or criteria information that has been devised by various clinical providers within the community and across the nation that that help us make those decisions based on your specific conditions and what services and equipment that you may already have, and what we need to provide for you to make sure that we can continue on your way to optimum health. So in closing, I just wanted to leave with you with a little bit of additional information on how to contact us. We do have a website, kernfamilyhealthcare.com. There's a lot of information on there. It talks about our providers. It talks about our services. We have newsletters. We have provider bulletins. All of our board information when we have meetings are all located on the website. So there's a lot of information in there that helps you who to contact and what is available. Our member services department is open Monday through Friday from 8 to 5. There's an 800 number, as you see up here, and also a local number that you're able to call and ask any number of questions you may have, whether it's regarding who your doctor is, whether or not a service has been approved, or just general information about where to reach out to someone else in the company to determine whether or not they can be of assistance to you. We also have access to a 24-hour nurse line. So in the middle of the night, if your child wakes up and they're feverish and they feel sick and you don't really know what to do, you can call the number and they will walk you through and help you decide whether you can wait to see the doctor or do you need to go to the emergency room right away. They also can give you information on different health topics. So just say you have a question about asthma, or you have a question about pregnancy, or even diabetes. They can walk you through in English and Spanish, and it'll prompt you to pick that specific topic, and it'll give you some health information regarding that. And also they're able to provide urgent care and emergency room assistance. They can tell you who our contracted urgent cares are, and also where the closest emergency room is as well. We have 2 locations, one on Truxton Avenue at Mohawk and Truxton, and another one on Stockdale Highway near Callaway. So in summary, I wanted to make you aware that CCS and Kern Health Systems have a long-standing partnership, and it's been strengthened over the years due to the collaboration between management of CCS and Kern Health Systems. We want to ensure that we coordinate your services, ensure that you're able to have that continuity, that continuing care as you make this transition from CCS to Kern Family. The referral authorization process is really a responsibility of your providers, but you will be getting notifications, and so it's important that you understand that process as well. And the Member Services Department are very eager to help you with any questions you may have regarding any aspect of your health care. We want to make sure we eliminate all the barriers: transportation, contracted providers, local providers, out-of-area providers. We want to make sure that you can get to where you need to get there and get there on time, so that you can have the services that you need and deserve. And again, just making sure that we work collaboratively with California Children's Services to continue our goal of creating new programs, new processes, and working together so that we can make this transition as smooth and as easy as possible. I really appreciate the time that you've given me to speak here today. I'm open if you have any questions or concerns. I know that we're on a time frame for the program, so I can maybe take a few now, or if you want to speak with me after the program, I'd be happy to do that as well. Are there any questions right now? Okay, I thank you for your time, and I hope you're enjoying the program today.
Deborah, thank you so much. Just a reminder, again, you have about 15 minutes left to talk to members of the track team if you haven't done so, and then we are going to draw for the iPad mini in about 15 minutes. So at this time, I would like to bring up with the Greater Bakersfield Legal Assistance, we have Amanda Lasprogato.
Good afternoon. My name is Amanda Lasprogato. I am a staff attorney at Greater Bakersfield Legal Assistance. At GBLA, I work in the health unit, and so we try to assist people with any barriers that they might be encountering relating to their eligibility when it comes to healthcare or the services that they're receiving. Greater Bakersfield Legal Assistance is a nonprofit organization. We offer free legal services to residents of Kern County. In our particular unit, we have outreach workers who can go out and give presentations to agencies or to groups of families or neighbors. We have health advocates who can assist people, and we have an attorney, which is me. And really quickly before we start, the purpose of this presentation is to provide legal information. So if you're having a problem, it's probably going to be very specific to your care and your doctor and what you're going through. And so this presentation is not necessarily legal advice for you, but information on your appeal rights. So we're going to talk about appeals today. There are different requirements and different timelines for appeals depending on the program. So for the most part, today we're here to talk about California Children's Services, but many people in this room may also be regional center clients. You might have Medi-Cal, you might be in a managed care plan like Kern Family, like Deborah just talked about, or you might have covered California insurance or insurance through your employer. This covers Denti-Cal also if you get dental services through Medi-Cal. So all of these different programs have different ways that you can appeal if you have an issue with what's going on. But there are some general rules, and so we're going to talk about the general rules today. It's really important that when you have a problem and you decide that you want to file an appeal or file a complaint, that you check the specific rules for whatever program it is that you're looking at. So what is something that is appealable? Whenever your services are denied, for example, maybe your doctor wants you to go have speech therapy and it's denied by your plan, or maybe it's not a CCS covered benefit. Whenever something is denied, that's appealable. If you're denied for a particular program, maybe your eligibility for CCS or eligibility for Medi-Cal, that's appealable. Also, if something is delayed, Deborah talked a little bit about getting your doctor to send an authorization and the quick turnaround time. If you think that the turnaround time is taking too long, or maybe something has been approved, but you've been unable to schedule an appointment, maybe you were trying to schedule an appointment with a specialist and they don't have something available for 2 months for you, that's something that would be an appealable issue. If your services are reduced, maybe before you used to get therapy 3 times a week, and now you're only authorized to get therapy 1 time a week, that's something that you could appeal. And then lastly, if your services are terminated, so if you get cut off from a program, or if you're no longer able to receive a certain medication or service that you were receiving before. If any of these things happen to you and you think that the decision was made wrongly, then you have the right to file an appeal. How will you find out if this happens? Most of the time, you'll get a written notice. So anytime your benefits are changed, reduced, or terminated, you should get something in the mail or some type of letter stating that this is going to happen. If this happens to you verbally, maybe you go to the doctor and the doctor tells you something's going to stop, you could always ask for a copy of this in writing. When you do get a notice, Your notice generally must tell you the reason for the decision. It will also have instructions telling you how to appeal and where you can go to get help, whether it be legal services or an advocate at the regional center. They should tell you where you can go to get the help you need so that you can file an appeal. One important thing to keep in mind is that if you're already receiving services and they're being terminated, you might be able to ask for those services to continue while your appeal is pending. This is called aid paid pending. Basically, you're asking to continue to receiving whatever service you have while your appeal is being decided or going on. How long do you have to file an appeal? So this is especially one of those areas that you should check the particular program that you're having the issue with, because they're different. But a general idea to keep in mind is when you receive your notice. Or when you receive your notice and you look at it, the date that the notice was sent was the date that you want to go by. Sometimes if there's a problem with your mail, you might get it later or you might not get it at all. Another good rule of thumb is that if you did not receive a notice, then you should go by whatever date it was that the thing you're appealing happened. So whatever day you went to the doctor or someone told you no, whatever bad thing it was that you think was wrong that you want to file an appeal on, you want to try to use that date. And you always want to try to file your appeal as soon as possible. What should you include in the appeal? You want to always try to communicate in writing when you ask for an appeal. It's important because then you know what you asked for, what date you sent it on. And so in that writing, you want to explain what you think the agency did wrong and then why you think it's wrong. So you might want to say, you know, my health plan is denying this medication and I disagree because I need this medication for whatever reasons. Again, if you're already receiving services and you want them to continue, you want to ask that in the appeal when you appeal in writing. And then if you need an interpreter because English is not your first language, you can ask for an interpreter at any time, but it's always best to start as early as possible. So when you file your appeal, make sure you add in if you need an interpreter. If you forget, you could ask all the way up until the time that you go to a hearing, and always let the judge know if you need an interpreter or if you don't understand. So after you file the appeal, most programs have some type of informal resolution depending on where you're filing your appeal. So usually someone from the agency will contact you, ask you about your problems, and they'll try to fix the problem before you have to go any further and go on a hearing. We recommend that you do not withdraw your hearing request unless all of your problems are fixed. So maybe you're going to a hearing because you wanted to get 2 types of therapy, and the plan or CCS or the regional center, they call you and they're able to provide you with one of those types of therapy. If you don't feel like they have addressed all of the problems that you're having, don't withdraw your appeal request, and then you can go forward and still be heard on the issue that you're having. So if you're not able to resolve your problem through the informal resolution, then you'll go on to a fair hearing. A fair hearing could either be in person or on the telephone. If you have a preference, you should include that in your request. Once your fair hearing is scheduled over the telephone, you can always change it to in person, but it might take a little bit more time. So basically, the fair hearing is your opportunity to tell an administrative law judge your story. So it's not like going to court, although it is in front of a judge, and that judge is going to make a decision on your case. You'll get a notice of the date of your hearing in advance, in writing, in the mail, before it happens. How far in advance you get that notice is going to depend on the program. So after the hearing, you'll get a written decision in the mail, and then if the judge decides in your favor, then the agency must abide by that decision. And so they have to follow through and do what the judge is ordering. Preparing for a hearing. So if you go to a hearing on any of the issues that we've talked about, you're allowed to bring witnesses with you to help explain what you need or what your child needs. The other side, the agency, might also have witnesses that come with them. You can ask questions of both. If you want to bring a witness, maybe it's a teacher or a nurse, a caregiver, a babysitter, someone who knows your child and your story, and you're able to ask questions of them so that they can tell the judge about the issues that you're having. You have a right to review and get copies of your records that you might want to use to support your case, or any letters that you have, doctor's notes that show why you need a particular service. And you also have the right to view any documents that the other side shows the judge. If you write down the dates and names of people that you spoke to about your problem, it can help you think through the things that you want to present to the judge in a very clear way. During the hearing, if you think that the agency representative said something wrong, you should tell the judge. If you think something is unfair, you should tell the judge. This is really your opportunity to talk about why you need this particular service or this particular program. And you also have the right to bring an advocate to help you tell your story. Anyone can file an appeal, and so you may want to ask an experienced advocate or an attorney to help you, but your advocate could really be anyone who knows your story and who you want there to support you and to help tell your story to the judge. This is our contact information at Greater Bakersfield Legal Assistance. We are located on 615 California Avenue. We accept walk-in appointments, and the phone number that's listed below is our office line. And we have an intake coordinator who speaks English and Spanish, and we also have translators available for other languages so that we can help you and find out about your problem and advise you if you think you want to file an appeal. Any questions? Yes. I think we need a microphone.
This mom has a question. ¿Qué es su pregunta? She has a friend, and they took her CCS program away. And her friend has a son with special needs. And she wants to know why they took her CCS away.
Okay, so that's an example of an appealable issue when someone is terminated. So it sounds like your friend, her child got terminated from the CCS program. I wouldn't know the reason why without knowing more about the case. But that's something, if she still wants assistance, she could come to our office, we could help her figure out why, and she's entitled to file an appeal.
Y si su amiga quiere ayuda, puede ir a hacer una cita y puede ir y le pueden ayudar y le pueden decir la razón por qué le quitaron el CCS.
Thank you.
All right, Amanda, thank you so much. The time has come now to draw for the iPad mini, as promised. All right, you ready?
We're ready.
You want me to hold it and you can draw?
Oh, no, you go ahead and draw.
Oh, gosh, you're going to put it on me?
That's right, go
They're
ahead.
going to hunt me down in the parking lot if they don't win. So let's see, no name. All right. You guys ready? Okay. The winning number is 889132. Is that you? She's been waiting all afternoon to win something. Yeah.
Wow. Is your ears okay? Wow.
Congratulations.
Thank you all for doing that survey. It really is an important part of our program. So we'll be continuing doing the survey all the time for those of you with children that didn't come today. So thank you.
We're going to close the 2015 CCS Transition Conference with CCS Scholarship Awards. You probably don't know, but your CCS staff spends their off-duty time fundraising for CCS kids that are going to college. Now, when they're not doing their regular jobs, your CCS staff is raising funds and working with youth to leaders to give these awards every year. So this time we'd like to bring up Kim, Stella, and Daniel to tell you about the CCS Youth to Leaders Scholarship Awards.
I think we're a little ahead of schedule, so Youth to Leaders are not going to be here until about 2 o'clock. So, first of all, I'd like to thank everybody for being here at the CCS Transition Scholarship Award Ceremony 2015. My name is Kimberly Kelly, and this is Stella Cobian. We represent part of the fundraising employees at CCS. CCS started having our transition fairs in 2011. During our transition fair in 2012, a wonderful woman who was the medical therapy supervisor at the time, Susan Kurtz, mentioned an idea for our kids transitioning out of their program and going on to college. She thought a scholarship to go towards transitioning college-bound students would be a wonderful farewell gesture. This idea took root and we started the process rolling. With the help of our innovative and visionary director, Tony Polito, we were able to make the right connections to persons and agencies to create a partnership with Youth to Leaders. At this time, we would like our director, Tony Polito, to the stage to be part of the award ceremony. Well, I guess, they are. One moment. Christian? We were a little bit ahead of schedule. We had a few things we wanted to give our students because they're so amazing. If you could just bear with us for about 5 minutes, we're going to get everything together. Thank you. Sorry about that. So, this will be our second year giving out the scholarships. We are very thankful for Youth to Leaders for guiding us and providing professional assistance in the scholarship process. Through our partnership with Youth to Leaders, check donations are also tax deductible. So we employees got together to raise money through raffles, charging $5 a month for the privilege to wear jeans on Fridays and selling various supplies at our little mini mart to the employees during the week. There were even some private individuals that donated money directly to the fund. It was through this hard work that we were able to raise the scholarship funds we have today. But I can say the toughest part of this process is selecting which students would receive the scholarships. In the personal essays that each student wrote as part of their application process, there were accounts of amazing perseverance through the hardship of medical and physical factors. They also wrote how they believe in themselves and their futures and plan to rise above and beyond their economic status and physical limitations. They have specific dreams of professions in the medical field, the law, and being leaders of the community. You would see examples of them facing and beating odds that most of us have not had to bear. Instead of their hardships keeping them down, they learned early on they have the ability to create their own futures and step by step make their own reality. As we award the selected winners of the CCS Transition Scholarships, keep in mind, our amazing winners here today are the students that stood out among all the deserving applicants. Our only wish is that we could have raised more money to share with all of the students instead of having to choose. So it is with honor and admiration that we award these amazing students. When we call your name, can you please come forward and accept your scholarships?
Our first scholarship winner is Jasmine Aguilon.
Yes, thank you.
Our second scholarship winner is Gerardo Garcia Herrera.
Congratulations.
And our third scholarship winner is Kelly Ayon.
These are amazing winners, and we're very proud of them. Please give them a hand. Okay, thank you.
All right, congratulations once again to our scholarship recipients. We want to thank you so much for attending the 2015 CCS Transition Conference. I hope you learned a lot today and enjoyed yourselves. It's been a wonderful day, and we will definitely see you again next year. Have a great day.